Blood pressure is the leading risk factor for heart disease and stroke, but it can often be prevented or really managed very well if diagnosed and treated properly. In our HealthCast today, we're going to see how there's a new comprehensive hypertension center at UHealth right here in South Florida, and it's really helping patients reduce their risks and improve their health. As Pradip Basar reached his 60s, a knee injury left him battling with his weight and in turn skyrocketing blood pressure numbers.
180 by 110, so my son has to take to emergency room.
It became what he calls his wake-up call and brought him to Dr. Maria Delgado, director of the University of Miami's Comprehensive Hypertension Center. The center has created 4 pillars of care, starting with genetics.
So genetics are important to understand risk of hypertension, to understand even the type of hypertension that you're going to develop.
Along with family history, the center looks at how environment and behavior affect those genetic factors. Experts also do a biochemical analysis, looking at salt sensitivity and abnormal potassium levels.
So this is important because we can separate patients that are purely salt sensitive, meaning that they respond to salt. The majority of hypertensive are like that. If they eat salt, the blood pressure goes up, and everybody more or less relate to that. But there's also groups of people where the salt is not the predominant defect, but it's more the potassium, so they cannot hold into their potassium.
The center also does a physiological study of how a person's blood pressure can change throughout the day and night.
Seeing how you behave and your blood pressure behave during those time periods is important for treatment.
Since joining the center, Pradip lost weight and brought his blood pressure into a safe range. Along with diet and exercise, he makes sure to get his daily step count in.
Minimum 12,000 steps a day I have to do. That's, I made up my mind. And if I do more, that is in benefit for my health.
Get those steps in. Nearly half of all Americans are grappling with high blood pressure, but less than half of them have that blood pressure under control. Some don't even know that they have a problem in the first place.